a single pass of the needle of the needle, and then all the materials you get, then you can produce many slides. And if, for example, then you need more samples, then you may decide to say, you go back and do more samples. But usually that would be if you are having a pathologist on site who is able to tell you what more samples you need and how many in terms of the number. But if you are in a practice, for example, where you are all alone, 3 samples is enough, because all that you want to know is this a benign lesion? Is this a malignant lesion? Is this an infectious lesion? So that is or is it just a cystic lesion? So that's the type of information that you are looking for. And in those 3 slides, when you have a good cell yield, you will be able to get all that information. So once you have finished to put in your smears, what you can also do, for example, if you want to submit a tissue for microbiology, you can take the needle that you use for sampling, and then take whatever contents that were inside the needle, and then just rinse them in a saline, and then submit that for microbiology. And if you are doing LBC, your sample, instead of like putting them on the slide, you may put a few on the slide and then take the rest of the tissue and put it in an LBC sample. So that means that in the lab, once you get the lab, it is fixed. It should be centrifuged to then get a sediment and produce cytology tissue blocks for histological assessment as well.